Hey y'all, Shelly here with another tip for hospice nurses. So I've had a couple of requests to do a video on what is required to be in an e-kit. An e-kit or an emergency kit, comfort kit, sometimes hear it called. That's the medications that we will leave in the patient's home just in case we need them. And we need them in the middle of the night. So the request was to talk about what's required to be in an e-kit. And the easy answer to that is nothing, because e-kits are not a requirement. E-kits are something that about 98% of hospice agencies will provide for their patients to provide that, I think, extra layer of care so that when we need something in the middle of the night for symptom management, we have it easily available. So I think that there are 4 basic things that you're going to see in an e-kit, and I've seen anywhere from basic all the way to the entire kitchen sink in the e-kit. But the 4 basic things that you need are going to be morphine, mostly for breathing, but also for pain, but we generally use it for breathing. And then something for anxiety, which is usually going to be Ativan. Obviously, if the patient has an allergy to that, it would be something else. And then something for nausea. What I mostly see now is Zofran. I will tell you that my personal favorite for nausea is Vistaril, because it works for other things as well. Vistaril can work for itching. It can work for sleeplessness. It can work for that general agitation, kind of I just feeling itchy all over and agitated. So I like Vistaril, but we generally see Zofran. And then something for terminal secretions. In the old days, we would put Atropine drops. But then they became hard to get, and from what I understand, very expensive. So what I see mostly now is Levsin or Hyoscyamine. I think I'm saying that right. Don't judge me. I never know how to say that word. But the Levsin, the one you put under the tongue, which, it works kind of good, but you have to usually do several doses on it. But those are the 4 basic things. So you're going to have morphine for breathing, something for agitation, something for nausea, and something for terminal secretions. Now, a lot of times I also see Ducalox suppositories. If you're going to cut something, I personally think you can cut that, because I don't think we're going to have a middle of the night constipation emergency. Also, we'll see Tylenol suppositories a lot of times. I think that's another thing. If you got to cut something, I would cut that, because we use it, I think, for terminal fever, which it's not effective for true terminal fever. Although I don't think they're that expensive. So if you want to leave it in, it's something to leave in. Now, in the old days, we would customize the e-kit to the patient's diagnosis. So if the patient had, say, something that they were going to be at risk for fluid overload, and they weren't already on Lasix, we would put Lasix or some kind of diuretic, whatever the doctor would order, in their e-kit. If they're going to be at risk for something else, like for severe itching or something like that, put something for itching in there if you don't have Vistaril. Just whatever you think the patient is at risk for, talk with the doctor, and that's what we would put in the e-kit as well. So that's basically the e-kit and how it works. Usually it comes in some kind of a bag or a box. I always tell the patient, I tell them right upon admission that that's going to be coming. Stick it in the refrigerator, leave it sealed up, don't mess with it, that the nurse is going to tell them how to use the medications in there if necessary. And I always say put it in the refrigerator, because that just kind of out of sight, out of mind. Also, remember, if your patient has been on service for 6 months, you always want to go in. I will open it up and check expiration dates and things like that on the e-kit to make sure that everything is still good, because you don't want it to be expired when you need it in an emergency. So I hope this tip was helpful. If you have any tips that would be helpful for hospice nurses, or if there's anything you'd like me to talk about, please let me know. I'd love to share it here. And remember, if we work together, we can change our world.